Thank you, my lady.
Would you like to carry on where we left off? We were dealing with the observations that you made with
Yes.
specific reference to certain of the incident scene photographs that were taken.
Yes. My lady, I don't know, I've just got to apologize. I don't know, I haven't been following the exhibits and the numbers, etc. But these are a set of photographs taken at the scene with the deceased in the bathroom. And what, if I can just take the board through some of the photos.
We must just identify the photographs and the exhibit number.
Yes.
I think that's now Exhibit C that you're referring to, and there's certain annexures under Exhibit C.
That's correct. It's the first photo here is got an Exhibit C, and I'm looking at photograph that is got on the top right corner blue writing, blue sticker.
What is the number?
10.
Right, but which annexure number is that?
It's annexure C.
Annexure C, Exhibit C. I know that's Exhibit C, but under Exhibit C are various annexures. Or not in that bundle.
It's annexure C.
So
Starts
Exhibit
off-
C, Annexure C, that's right. Photograph number
10.
10. Thank you. Carry on.
My lady, I can come back to the other injuries. I won't explain them now, but what this photograph shows is the left side of the neck laterally, almost 90-degree to the left side. Again, one can see the ligature imprint. And it's not of the blanch feature. It doesn't have the features of being blanched. It's got, there is, again to be more accurate, it's not, there is one small area in the middle of that which is blanched, but the rest of it is parchment-like and leathery. That's even number 11, photo 11. Annexure C
Exhibit C.
of Exhibit C shows again that it is parchment in its appearance. It's not blanched. And again, which may become relevant later, one can see that the ligature then goes up and towards the back of the neck. Unfortunately, from all the photographs available at every level, there isn't one showing the back of the neck,
Other than the ones you've taken.
other than the ones I took, yes. Now this, my lady, if I'm going to express an opinion, this is probably the best set of photos because they are closest to the time of death as opposed to 2 days later the autopsy and even many days later when I did the photos. So this is probably the best set to be able to express some sort of opinion from photos apart from direct observation. Now, my lady, those two photos that I said 10 and 11 can be quite easily contrasted with photo 12, which shows the blanching. So, in a nutshell, what I was saying to the court is that the most probable point of suspension is related to the right ear, and then the ligature comes down across the neck, almost transverse on the left side, which is opposite the point of suspension, deepest with the leathery parchment type appearance on the left side, then goes around to the rear of the neck, and then gives appearance that it is then also coming to the point of suspension. Rising up to the area of the right ear.
Now let's go back to your report, and at the top of page 4,
Yes.
where you say there were bruises and the imprint on the left side anterior-laterally.
That's right. That's what I drew to the court's attention, that it wasn't all that blanched, but
Okay.
it's better expressed in the photos that were seen closer to the time of death.
Then it says here, the imprint in this case is consistent with a smooth ligature like an electric cord.
Yes.
Now remember you earlier spoke about the most common type of ligature being a sort of rope.
That's correct, yes, my
Would you
lady.
like to just deal with that, please?
Yeah, the commonest ligature is a rough object like a rope. The second is an electric cord. And the electric cord doesn't leave the same amount of friction as a rope with a rough surface, because the flex, the outer covering, is smooth. Because of the pathophysiology, my lady, that I expressed, with the greatest amount of force being opposite the point of suspension and the convulsions that take place, that will be the area with the greatest amount of tension between the ligature and the neck.
Yes.
That's why we see what we see in the photographs that I've just demonstrated.
Okay, let's read on in your report. There were no abrasions or bruises related to the superior or inferior aspects of the ligature imprint. You're now obviously referring to what you observed at the second autopsy.
That's correct, yeah. In other words, my lady, what I was saying, if we're looking at the imprint itself, there were no abrasions. Then if I was going to extrapolate that, there was no attempt by somebody to try and grab at that ligature as a second or an afterthought.
Then you say, yeah, as I think you have testified, the most likely point of suspension is on the right side below the ear, as on the left side the ligature was 95 millimeters below the external auditory meatus, and on the right side it was 63 millimeters below the external auditory meatus. Won't you just translate that into common lay language for us, please?
My lady, what I was saying is that ligature was lower on the left side and higher on the right side. So that told me that the point of suspension was probably on the right side.
Now,
Sorry, the external auditory meatus, just for the record, is the outer ear canal.
okay. And these measurements of 95 and 65 millimeter, who measured them?
Myself, I did.
Right. Now, you recall that similar measurements were not made by Dr. Khan, except he made one measurement, I think, from the heel of the body.
That's what I recall, yes.
On one side only, though. And he expressed a criticism of you and said, your measurements in this regard are meaningless because you didn't take into account anatomical distortions caused by the first post-mortem. Can you comment on that?
My lady, I made the measurements that were available to me. I must say that there would be some degree of distortion in terms of the incisions that were made at the first autopsy and the reconstruction subsequently. I will most definitely make room for that because it's part of an autopsy artifact.
When you say make room for that, what are you saying? Take that into
Take
account.
that into consideration, sorry, yes.
Now, without worrying about the exact measurements, 95 and 65, I'm going to ask you to get a Koki pen. I've got a model here. I'm going to set it up on the stand. I'm going to ask you to come around here and just, this is not to be drawn to scale. I'm just wanting to give your understanding of exactly where, without measurements, this ligature was located. I have some assistants just to help me lift this up. Thank you so much. Dr. Perumal, if you can position it so that the court gets the best view.
There. What I've done is I've just drawn the Koki pen to show from my observation and from the limited observations that I have from the photos taken in the bathroom.
Can you make the line a bit darker, please, or broader, because it's quite difficult to see from here. Specifically not asking you to draw this to scale and measurements, but thank you. Now, can I just ask you a question? When you made your measurement of 95 millimeters, would you show the learned court from where to where that was?
My lady, that's the external auditory meatus, and the ruler was put from there down to that point, which was 65 on the right, and on the left side,
Turn it around.
One can see that the ligature imprint was rising up on the right, and on the left side, it was lower.
And that was a 95.
But 3 centimeter difference.
Right.
It was that observation that allowed me to make the conclusion that the most likely point of suspension was on the right side.
Let's carry on with your observations, and you can move quite fast through the ones that are not really in contention. Starting with 4.2.
4.2 is a 20 by 2 millimeter linear abrasion on the underside of the right chin, underside of the right side of the upper neck, below and medial to the right ramus of the lower jaw. My lady, that's number 7, exhibit triple H.
That's your photo album?
My photo album. And I point to it.
So in other words, what you're saying is there's a scratch there.
There's, abrasion. Yes, scratch.
Okay.
And 4.3 is right next to it. It's a smaller one, but more posterior to 4.2.
Right.
4.4 is a 6 by 1 millimeter abrasion on the undersurface of the chin, just left of the midline. My lady, in photograph number 8 of triple H and photograph 9 of triple H, one can see that abrasion on the undersurface of the chin. 4.5 is 11, it should be millimeter by 1 millimeter linear abrasion undersurface of the chin, left of the midline. I'm pointing to photo 9, my lady. And then 4.6 is, if one looks at it, is 5 punctate, small pinpoint size hemorrhages left of the midline. In the front of the neck, left of the midline, and that's visible in photo 9 of triple H.
Let's just go there. Which is that now? What is visible here?
Photograph number 9,
Correlates with what paragraph in your report?
4.6.
5 small pinhead-sized abrasions.
Yes.
On the low. Can you just pinpoint those? I'm sorry, but I can't see them. Oh, yes.
My lady, number
Yes,
9.
I see them
Okay.
now. Thank you. Right, carry on. The
No.
NB there.
Note, under the examination with underlying soft tissue. Now, the skin, the incisions are undone, the sutures are undone, the skin is now flapped over, and the underlying soft tissue revealed multiple post-mortem artifacts. I couldn't identify any definitive ante-mortem bruises in the subcutaneous tissue or the muscles at the time that I did the autopsy. Now, might I just pause here and make reference to a case that made international headlines and caused enormous unnecessary confusion. A well-known personality who was the coach of the South African cricket side, a gentleman by the name of Bob Wilmer, who was a South African coach. By the time that he died, he was the coach of Pakistan. He died during a World Cup, Cricket World Cup in the West Indies. And unfortunately, because of resuscitation and other things that happened to the deceased, it was concluded that he died, he was murdered, and it was linked to match fixing, betting, whatever. A second autopsy was done, which made the neck findings even more expressive or extensive than the first autopsy, and he then had a third autopsy done, and finally it was concluded that he actually didn't die from neck pathology, he died from a cardiac pathology. It was a natural death. And the point I'm making is, we learned from doing autopsies that especially in the region of the neck, got to be very, very careful about making emphatic findings after such a period. Because once you start cutting the tissue, everything looks like everything is injured. And so I said at the time, I couldn't make any identifiable definitive findings in the soft tissue. But that doesn't mean I dispute any findings made at the first autopsy. I don't. I'm simply saying, my lady, what my observations were and whether I could really say this is a definitive finding.
Right. Carry on.
Then I mentioned that there was no definitive fracture of the hyoid bone or the thyroid cornua. There was an area of red discoloration on the inner aspect of the left side of the body. There's a duplicate related to the body, the inner aspect, left side of the body, of the hyoid bone, but with no excessive mobility. This is what I said, there was no fracture and there was no joint pathology. This bone, as I indicated earlier, was subject to X-ray examination and no fractures were demonstrated. However, I must say, because of the post-mortem artifacts, my lady, I did find a break or an interruption in the integrity of the thyroid cartilage.
As opposed to the hyoid bone.
Correct, yes. My lady, that's seen in photo number 33 of Triple H.
This too was put to Dr. Khan in cross-examination. You will recall.
I do.
Photograph 33, did you say?
33 of Triple H. My lady, I use my pen to demonstrate what it is. That's the cornua.
The horns.
The corns, yes. The thyroid cartilage has got corns and the hyoid bone has got horns.
Yes.
Okay. So if one looks at it, there's the area that I'm talking about. And again, one can see that there's a break there. The integrity is gone, it's broken.
Yes.
And there's no hemorrhage that I can observe associated with it.
Okay, do you have other photographs of it?
Photo 34 shows it slightly closer, because 33 is to show you where it is anatomically. 34 is to show it to you a little bit closer. But what I did in photo number 35, my lady, I've then taken a forceps and bent it. And to me, it's an incised fracture.
So what does that mean?
My interpretation, that was caused probably accidentally during the first dissection.
Right. And that was put to Dr. Khan. Now you remember that Dr. Khan had roundly criticized you for not having even observed the alleged fracture of the thyroid cartilage. The first question, is it true that you did not observe it?
I did. That's what I just
Photographed.
put before the court and photographed.
Right. Your opinion is that it was a dissection, in other words, an autopsy artifact.
That's correct.
In other words, caused by the doctors doing the post-mortem.
Yes.
Okay.
And the basis for that is, it appears from my photo, it's an incised fracture, and from the photograph, there's no associated hemorrhage with that fracture.
Right. Now, as you know, Dr. Loftus is present here in court today, and he has studied all of these slides and photographs, and he will confirm your view in that regard in his capacity as both a forensic pathologist and an anatomical pathologist. Do you not record in your report that there was a post-mortem artifact in the form of an injury to the thyroid cartilage?
I'm not sure. I'll just...
I think what you said here was, I think if you look at page 4, at the bottom, you say there was no definitive fracture of the hyoid bone or the thyroid cornea.
That's right.
I mean, is it common to record post-mortem artifacts as findings?
Now, if you have to detail everything, then we would lose sight of the actual pathology.
Okay. But you recorded it by photograph.
I did, yes.
And insofar as the...
Let me further say, I didn't put too much of emphasis on this thyroid cartilage because I thought it was an incision, because Dr. Khan told me that he found a fracture of the hyoid bone, and that's where the emphasis was.
Yeah, absolutely.
Yeah.
Dr. Khan denies that he told you there was a fracture of the hyoid bone. Do you want to comment on that denial of his?
My lady, and that's the approach I used here. I didn't put any emphasis really on the thyroid cartilage.
Can I just repeat my question?
Yeah.
Dr. Khan, when I cross-examined him, denied that he had told you over the telephone that he had found a fracture of the hyoid. Would you comment on that?
Yeah, I think that's not true. He did tell me about it.
Okay, now I want to show you part of exhibit. Just get the right.
Sorry, I was just making a note. You said your emphasis was on, and I got the council.
My emphasis, my lady, because of my pre-autopsy discussion with Dr. Khan, the emphasis was on the hyoid bone.
Thank you.
And hence, the investigation that I subjected it to subsequently.
Focused on that.
Yes. I did observe the thyroid cornua defect, which I concluded was a autopsy artifact. I know that one of, I think it was Dr. Abrams, who made a comment that I should have subjected the thyroid cartilage to an X-ray examination. You will not see pathology of a cartilage on an X-ray, because an X-ray examination is for bony pathology, not for...
So that comment was meaningless.
That's the bottom line, yes.
Okay, now I want to get back to my question. As part of the documentation handed in this case was the handwritten note. Let me put it this way. A copy of the handwritten note allegedly made by Dr. Khan whilst he was performing his autopsy. I say a copy because despite 100 requests, we haven't been able to see the original. Now, I want to show you something on this report. I want you to tell me, as a doctor and as a forensic pathologist, what interpretation you put on this. And I'm going to mark it with a pen, a red pen. I've got one. It's 9 lines down from the top. Could you show that to the witness, please? I know you've seen this document, but I just want to orientate you. That's exhibit F1.
Okay.
What do you read there, and what do you and any other medical practitioner interpret that as meaning?
My lady, it's 2 lines going down and side to side.
Like a hash sign.
Hashtag. Hash sign saying, to us. and internationally, that's a sign for a fracture. Left posterior hyoid. There's only one way to read. The hyoid bone is fractured.
On the left side.
That's right.
Thank
And
you.
if this accords with my telephone conversation that I had.
Thank you. Thank you. Now,
My lady, can I just have a look at that? I'm not at the same place now in the exhibit.
So before we proceed, I think are we done with this, Dr. Perumal?
I'm done.
No, with the mannequin. Can we put it down?
With the
Sort
Yes,
of
my lady.
obstructing my view.
I'm sorry.
Sorry, Mr. Panika, you wanted to raise something? Mr. Panika.
I've seen what I wanted to see.
Oh,
Thanks.
thank you.
I think if we could go to the top of page 5 of your post-mortem examination report. Is there anything that you want to add? I think we've dealt with that.
Yes, I want to move on to 4.7.
Please do.
My lady, 4.7 is a 6 millimeter linear abrasion on the top of the base of the big toe. That's photo 16 of Triple H. And 4.8 is a 4 by 3 millimeter abrasion related to the lateral aspect of the nail of the second toe of the left foot. My lady, again, I point photo 16 of Triple H, the second toe.
What is
4.9.
I just want to get back to a question while I'm thinking of it. In the absence of a colleague saying that he had found a fracture of the hyoid bone, and you not finding that, would you routinely photograph, X-ray or CT scan the hyoid bone on such a patient?
No, my lady.
Okay, thank you.
My lady, 4.9 is a 4 by 3 millimeter abrasion on the top of the second toe of the right foot. That's photo 17 of Triple H. Four point 10, 55 by 30 millimeter abrasion of the left shoulder superiorly. That's photo 18 of Triple H. .11, 9 by 4 millimeter abrasion of left supraorbital ridge laterally. That's a bony protuberance of prominence above the eye,
On the left
left side, but it's lateral. It's not over the eyebrow, it's just below the eyebrow. That's in photo 19 of Triple H. Now 4.12 is 38 by 6 millimeter hematoma of the left eye laterally and superiorly. My lady, that's in photo 19.
That's a bruise, in other words.
It's a bruise, yes. Now, that doesn't necessarily reflect an injury. That is more an extravasation, extension of the injury to the eyebrow with the blood, because the tissue around the left eye or the eye is very lax. The connective tissue is so lax that the blood extravasates into the tissue. 4.13, 17 by 10 millimeter bruise below and behind the right ear, my lady. That may be seen in photograph number 6. But the photos that we taken at the autopsy, the first autopsy, show it better. Number 6, photo 6 of Triple H, my lady. It's behind the small sutured incision.
Right.
4.142, small focal abrasions on the knuckle of the index finger. That's in photo 20 of Triple H, photo number 20. 4.15, 10 by 5 millimeter bruise on the left wrist, photo 21 of Triple H. Small bruise. 4.16, is an ill-defined bruise of the left forearm anteriorly. My lady, that's photo number 22 of Triple H. 4.17 is an ill-defined bruise on the right and left arm posteriorly. That's seen in photo 23 on the right and 24 on the left arm. 23 is the right arm, 24 is the left arm. 4.18 is a 260 by 160 millimeter healing bruise on the right upper thigh anteromedially. It's photograph number 25 of Triple H. .19 is 75 by 48 millimeter healing bruise of left upper leg anteromedially. That's photo number 26. My impression was that that's healing also.
We just pointed out.
My lady, it's just this section here. .20, multiple small healing bruises of the lower limb. That's photo number 27. My lady, I was looking at, if I can point that out, there, and there, possibly there. .21, the fingernails and the toenails were all painted gray and they were intact, just to look to see if they were broken or anything. And the photographs, one can see in photograph 28, 29, the black discoloration around it is the fingerprint ink.
I see.
Yeah. Right up to photo 31. So 28 and 29 is the right hand, 30, 31 is the left hand. Just to show the nails that are intact. And then, my lady, one or two photos do show the ECG adhesive pads on the chest wall. If I can just find one or two. Sure there was a photo showing that. Can't seem to, oh yes. My lady, in photo 18 of Triple H, I'll point to it. That's an ECG adhesive pad. My lady, because of my training, and I wrote a chapter in the book, Violence Against Women and Children, as part of my CV. It's mandatory on any practitioner who's faced with a case such as this, where a woman has died and has got some injuries, some of them healing, to do what is called a facial flap dissection. The reason we do that is twofold. My lady, because sometimes we don't see the injuries externally. It's only when we reflect the skin off the face as a mask. That we're able to see the injuries. That is in the areas that we can't really get access to. That's the only way. The second one is we can't easily see the inner aspect of the lips and the cheeks. So doing this flap exposes maximally, let's call it the hidden areas. And it's also a compulsory examination when anyone dies in police custody because of the issue of asphyxiation. So those are the two mandatory compulsory types of background in which this examination should be done. Now, I've done that, and
in this case.
Sorry?
You did that in this case?
I did that in this case at the second autopsy. It wasn't done at the first autopsy. I performed that examination, and it's actually, I've only put one photograph in here, because it's not very unpleasant to look at the photos after that dissection, but I did put one picture in here, photo number 32. I only put photo 32 to illustrate a point. Now, lady, I won't hold this towards the public, but this is what really happened. I've taken the facial tissue and moved it upwards and sideways to expose all the areas, especially when there's underlying bone, for example, the cheek, because if somebody is smothered, say using a hand.
Or a pillow? Or
Well,
what?
no, let me stay with the hand first.
Okay.
With the hand, and one must assume that if the person's alive, there's not going to be just a submission, there's going to be a struggle. And with that movement, over the protuberances of the bone, whether it be the chin or the cheekbones or the teeth, or the lips, when we reflect it, then we see bruises related to those areas that I mentioned. And if a soft object is used like a pillow, depending again on the amount of force and amount of resistance, you may see such injury. But less likely with such soft object as opposed to a hand. And I'm sorry to say this, but if you're using an interrogation procedure where they're using the inner lining of a tire tube, for extracting information in the police custody, my lady, that's when we also see, even though it's a soft pliable object, we still see bruises related to the face. Now what I did here, my lady, I extended it right up to the left orbital ridge, and one can see right on the top. The only finding that I could make was there's a bruise, but that's related to the abrasion that I showed externally. So that was the only positive finding upon this specialized facial flap dissection. So in other words, what I'm saying, that bruise I can link to an external injury, but I don't have any evidence. And as scientists, we only go with evidence. There's no evidence of smothering in this case.
Well, I just want to get back to one point. If such an examination, a facial flap dissection, is regarded as mandatory in such cases, and especially if smothering is now on the table, so to speak, would you comment on the fact that it was not done here?
My lady, firstly, it's mandatory in any woman who is found dead. Firstly, this examination has to be done. If I'm considering smothering, then there's an enormous onus on me to do it.
Okay.
Sorry,
But-
why only women?
Sorry, my lady?
Why only in women?
Because of the issue of, and no, I'm sorry, in a set like this, but I said when I do a case of death in custody, then we do it on the men also. But in a setup like this, because in the teaching of death, violence against women and children, because of the high possibility of smothering, that's why we say it's mandatory. I wasn't given an history here that there was smothering. I just did it because it's a routine. It must be done. But I'm not prepared to pronounce on anyone else who hasn't done it.
Other than to say it's mandatory.
That's it. Sorry, my lady.
When is it routine? I'm trying to understand if you say it's routine.
My lady, when a woman is found dead, and especially now that she's got some injuries, some of them are fresh and some are healing, that will certainly be a requirement.
Thank you.
But I know what counsel is asking of me, but I really don't want to pronounce on anyone else who didn't do the examination. I'm going to say what I've done.
Let's move on. Head and neck. Take us through that.
My lady, I reflected the scalp a little bit further, which is part of the process. I didn't find any deep scalp bruising. In other words, once we reflected, I didn't find. But I do know that at the first autopsy there was a comment that there was some bruising. I can't dispute that they did see it, but the changes could mask my observation. That's the one thing. The other one is it could be an artifact, a dissection artifact. But there certainly were no skull fractures.
Let's move along.
Number 6. My lady, the brain tissue had been dissected and put back into the body, and I then tried to reconstruct. And I could not find any pathology in the brain. Number 7, orbital nasal oral cavities. I found no pathology and no petechial hemorrhages. Petechial hemorrhages are pinpoint hemorrhages, roughly the size of the back of an office pin. Number 8, I found bruises on the tongue, and unfortunately the tongue was not incised.
So what do you mean
At the
now?
first.
What do you mean? It wasn't incised. What do you mean?
My lady, the tongue was intact and its normal original anatomical state.
And what would you have expected it to be?
I would have expected the examiner to make incisions, cut through the muscles of the tongue, because it is tongue is muscle tissue. To cut through it, and my lady, photo number 38 of Triple H. I will point to it, my lady, showing where the bruise is, because this photograph doesn't necessarily show it all that easy. It's the dark area in the muscle.
Possible causes of that injury to the tongue, and in particular, can I ask you to comment on convulsions as the etiology of the injuries?
My lady, bruises on the left side of the tongue, the lateral edge, is very likely to be associated with convulsions, the biting of the tongue.
Right, now you've...
But the larger hematoma, or the hemorrhage in the substance of the tongue, is, Bernard Knight and other authors say that you'll see it in asphyxial death. Not always, but in asphyxial death. It's one manifestation, but the explanation, the pathophysiology, is not being explained.
And when you refer to seeing it in asphyxial death, would that include death by hanging?
Correct.
Right, let's move on to the chest. Would you like to take us through again?
Yes, my lady. My lady, there were fractures of ribs 2 to 5 on the left side anteriorly. But there was no associated hemorrhage at the fracture side. My lady, that's photo number 40, but one is unable to see it. I'm trying to put my hand, my left hand, over the rib to try and show that it's, because it's just a movement, there's no hemorrhage. So I just photographed that section. But you can't really see it, but I did do the photo. It's more palpable than visual. There was also a fracture of the middle third of the sternum, also with no associated hemorrhage. But there was fracture of 3 to 6 on the right side anteriorly. My lady, that's photo 39 of Triple H. Again, one can't see the fractures, but you can see there's a bit of a hemorrhage. If I can point to one of the ribs, you can see a bit of hemorrhage associated with it. So the left side had no associated hemorrhages, the sternum had no associated hemorrhage, but the right side had.
Right, now, let's just pause there for a moment. Dr. Khan did not pick up any of the fractures on the left side of the ribs. So in other words, fractures 2, 3, 4, and 5 on the left side in the front, he did not pick up.
Yes.
He did not pick up the fracture on the sternum and only certain of the fractures on the right-hand side.
Yes.
Can you comment on the cause or the etiology of these fractures? Number one, and number two, can you comment on the presence or the absence of associated hemorrhage with some of those fractures?
Okay. Number one, I'd like to say, in order to properly elicit the presence of fractures on the rib cage, we perform a dissection called, and I don't know why, but everything in pathology is linked to food. But this is referred to as spare rib slices. What it means, my lady, is that a sharp instrument, knife or scalpel, is run through the intercostal muscles between the ribs, because the muscles splinter the ribs. So even if there's a break, you won't be able to see it until you loosen it and then individually move the rib. Again, this is not a criticism, but it wasn't done at the first autopsy.
On any of the sides?
No, to the chest at all.
Right.
So the observations that I made were made after making these spare rib incisions, and each rib was then examined. So that's maybe the reason why they were not detected. I'm not talking about observer error, but that may be the reason why it wasn't detected at the first examination.
I asked you to comment on the associated hemorrhage.
Yes, I'm coming now to, because the lady was writing, some of them got hemorrhages and some don't. Now, that would mean, those that had hemorrhage means there was some degree of circulation at the time that the fractures occurred. And those without hemorrhages means that there was no circulation at the time they were sustained. I'm waiting for counsel to leave.
I'm waiting for you to carry on.
I'm done with that.
Okay, well let me then ask you, you say where there was associated hemorrhaging, there was some degree of circulation.
That's correct.
Now, how can that circulation come about? Can that circulation only be when one's heart is beating and one's body is circulating blood? Can it be associated with artificial respiration, CPR, chest compressions? Can you just comment on that?
Yes.
Please?
Now, in terms of causation, it could be blunt force, that with the hemorrhage now.
Yes.
Could be blunt force injury, as in trauma, or could be linked to cardiopulmonary resuscitation.
Is it possible to tell which?
Only with the one with hemorrhage, you can get rib fractures, especially in that anatomical site of the right chest wall anterolaterally. In both situations, you can't differentiate. If it was posteriorly, then CPR won't come into the equation. This is in a typical site for cardiopulmonary resuscitation.
Now, in this particular case, we know that CPR, chest compressions, and we'll get to mouth-to-mouth respiration, was performed both from the deceased's left-hand side and from her right-hand side by two different persons at different times, and maybe at the same time. The one being Mr. Rohde, and you see him there. I don't know, I would estimate that he probably weighs about 75, 80 kilograms. And we know Mr. Thompson weighed 110 kilograms. These injuries, to what extent can you comment on the etiology of them?
My lady, in the context that was presented to me, if I recall that Mr. Rohde has had no training at all in CPR.
Correct.
Mr. Thompson had some training in CPR. Those of us who have had training in CPR, the dictum is, must do it aggressively even if you break bones, rather fracture, because it's not normally associated with any fatal consequence. Rather do decent compressions, even if you break the ribs, do the compression. So it's not uncommon to find fractures associated with CPR, and especially, I think, the size of the individual that was mentioned, Mr. Thompson, being a large built individual.
Right. Let's move on, please, to the other organs of the chest.
Number 11 was no pathology, number 12 no pathology, and then 13, the two lung, right and left lung, was edematous. There was petechial hemorrhages and ecchymosis. That's all that I found.
Okay, just to help us a little bit, what is the difference between petechial hemorrhages and ecchymosis?
Ecchymosis is basically a larger form of petechial hemorrhage where they coalesce. It's a bigger form of petechial hemorrhages.
And what is the significance of the presence of petechial hemorrhages and ecchymosis on the right, on the pleura of the right lung?
This is, again, my lady, we unfortunately have had too much emphasis placed on petechial hemorrhages and the significance of it. I will say in this setting now, it reflects hypoxia or anoxia. But it's part of this obsolete quintet of the so-called classic signs of asphyxia.
Right, I want to pause there for a moment. You say the obsolete quintet of the classic signs of asphyxia. Please go into more detail on that aspect, please.
My lady, for many years in forensic pathology, they looked for certain signs to conclude that somebody died from asphyxia. One of them, probably the most important emphasis, was on petechial hemorrhages. The other was congestion. Third one, cyanosis. Fourth, fluidity of blood. Fifth, dilatation of the heart. They are so non-specific. I don't want to give a discourse on it. Suffice to say that you can, in asphyxial death, you may not even see it, and you'll even see it in deaths unrelated to asphyxia. So we no longer place emphasis on these classic signs anymore. That's why it's called obsolete.
Right. And those 5 signs, the quintet.
Quintet, just 5.
Now I just want to pause here for a moment and go to your histology.
Yes.
As I have it, you did histology of the lungs,
Yes.
or am I wrong?
I did. It's number 3.
Okay,
On
and
the
your
report.
report in regard to the lungs was they demonstrated congestion and pulmonary edema, no inflammatory component, tumor or granuloma are evident, no other specific pathology is noted. Now, what exactly are you saying about the lungs now?
All it shows me is congestion and edema. Congestion means there's more blood there, the vessels are dilated.
Yes.
Edema means fluid present.
Build-up of fluid.
That's correct. And even in the alveolar spaces.
Right. Now, Dr. Abrams, in her wisdom, would have us believe that this deceased suffered such severe trauma to her right chest that she was virtually incapable of offering, she was physically incapable to the extent that she couldn't possibly have offered any resistance to an attack by her husband. Now, bear that in mind.
Okay.
Bear in mind that we're talking now about the lady who, excuse my French now, when they got back to the room, screamed that she'd cut her fucking toe, and in the morning, some hours later, showed her cell phone to her husband and said, "Look what your effing whore has sent me." Now, can you comment from your observations of the right lung is there any substance in the allegations of Dr. Abrams?
Lady, let me firstly say
No, I
that
don't understand that question. The context that you've given, I don't know how it links to your question.
Now, lady, I thought it was quite simple, but I'll repeat it. Dr. Abrams has alleged that the deceased suffered from such severe lung pathology that she was debilitated to the extent of even being unable to offer any resistance to any attack or assault. Can you recall that testimony?
I do.
Right. You have examined the right lung. You have done histology on the right lung, which Dr. Abrams did not do. Now, do your observations correlate with Dr. Abrams's allegation regarding the condition and the degree of injury to the right lung? I can add something to the equation. She also attributed the blood in the stomach of the deceased to blood which had emanated from the right lung and been swallowed. In other words, that the right lung was so injured that she was coughing up hemoptysis, I think it's called, blood, and swallowing it, and it was going down into her stomach. Can you comment on that?
Okay, my lady, unfortunately the response is going to be a long response because we have to differentiate whether this is an ante-mortem or a post-mortem or peri-mortem injury. Firstly, I didn't see the contusions in the lungs, and that may be because of the changes I mentioned yesterday, the autolysis. I didn't see under the microscope, because I took one piece of lung from each lobe, 3 on the right, 2 on the left. I didn't see contusions. I specifically said no other pathology noted, apart from the congestion and edema. So I didn't see it macro. As I said, it could be from the autolysis. I didn't see it microscopically, not under the microscope. But there was some photos showing contusions of the left and right lungs anteriorly. My opinion is based on the positions of the rib fractures, left and right side, and the sternum, that those contusions are linked to the resuscitation. If this had been an ante-mortem fractures, the lung contusion is not that significant for now. I'm going to explain the blood issue, but let's deal with the fractures. If somebody had had a fracture of the sternum and bilateral rib fractures, as described in paragraph 10, that person would be in significant amount of pain, with disability. Every breath would hurt. Many people sitting in this court would have sustained a rib fracture. I sustained one fracture, one rib, and it was extremely painful and uncomfortable. So, if these were antemortem fractures, it would seriously affect the Mrs. Rohde. The lack of circulation related to the sternal fracture and the left side indicates to me that they are perimortem or postmortem. Now, to go to the second part, my lady, of the question, which was the blood. I didn't get to it, but for me, the photos of the scene, which is annexure C of Exhibit C, clearly shows not blood-stained fluid, but blood in the nostrils. There's also a comment about the nose being distorted or deviated. My opinion is that there was an injury to the nose, and the blood was then going down posteriorly, was swallowed, down the esophagus into the stomach, and there was, for me, clearly two episodes of this bleeding, because the first episode is associated with the altered blood in the small bowel.
Repeat that last word.
The altered blood in the small intestine or small bowel. Then there was a section of bowel between the stomach and this area where there was altered blood that was free of blood.
The duodenal section, I think.
Yes, and proximal duodenum. And then there was fresh blood in the stomach. So the fresh blood in the stomach was the second episode of bleeding, and the blood, altered blood in the small intestine was the first episode. I'm unable to assist the court in telling you what was the time interval, sufficed because we all know the debate in Pistorius trial. You cannot predict gastric emptying. Lady, as far as the source of blood being the pulmonary contusions, from a physiological and anatomical point of view, it's virtually impossible for that to be the source. can't recall now, but I think there was about 100 mils of blood in the stomach and possibly about between 100 and 200 mils of blood in the small bowel.
That is the evidence.
Minimum 200 mils of blood. It's just under a cup of blood. It's impossible, virtually impossible, to have that amount of blood emanating from pulmonary contusions. You've got to have vessel injury, you've got to have vascular injury for blood to pour out. From the lungs. In that case, the lungs will exhibit, because there's breathing, as long as there's fluid in the airways and there's breathing, my lady, there'll be a mixture, blood going into the tubes, if I can use a term, and again into the alveolar or the air sacs. When we examine the lungs, it will have what we call a lipid skin appearance, and there's nothing there. Apart from the physioanatomical virtual impossibility, there is no documented evidence that the lung appeared lipid skin in appearance.
Now, while we're on blood in the stomach, one of the hefty criticisms of you by your colleague Dr. Khan was that you did not report the presence of blood in the stomach or the intestines, and by that token you didn't observe it. Would you like to comment?
Yes. My lady, when blood is found in the stomach, it's important to find the source. Is it a local source?
What do you mean by a local source?
The mucosa. Is the stomach, has it got any pathology that's contributing to blood in its lumen?
In other words, the lining of the stomach.
Correct. And the only way to do that is to properly wash the lining of the stomach. Because what you're looking for are not the obvious ulcers, the big ulcers. You're looking for erosions of the stomach, which is like smaller than the head of an office pin. It's called erosions, gastric erosions. It's the commonest cause of acute hemorrhage. So firstly, my lady, you'll have to take out the blood from the stomach, then wash the mucosa or lining properly to identify the source. We all know the practice. You take fluids, you discard them down the sluice. Unless you're expecting to find a projectile in it, which means you'll do something different with the blood. But when you have blood, it's discarded down the sluice. It is negligent to take fluid from the body and pour it back into the body. In fact, when the body is reconstructed, it's got to be as dry as possible because of the possibility of fluid oozing from the body through the sutures, because these are not surgical sutures that you get in theater. This is just to approximate the skin.
By approximate, what do you mean?
Bring the skin together to make sure that the organs within the body remain within the body. But if there's fluid inside the body, it will come through. That's why we pack the bottom and the top, and we make sure that there's very little risk Because the greatest risk to practitioners from a deceased person is people working in undertakers. They get a lot of infection, TB, hepatitis, all those infections, HIV. The people most prone are post-autopsy people. So we don't want to have blood just left in the body, and that's why we discard fluid, body fluids. Whatever we measure, we discard it. So I probably think it's a little bit disingenuous of Dr. Khan to say that he took the blood and poured it back into the body.
Well, we're going to argue at the end of the case about the validity of his evidence on that and many other points. But to get to your position,
Yes.
when you examined this body, were there any fluids or bloods or anything like that in the gut or in the stomach?
No, none in the stomach. And certainly what had happened to the bowel, that was opened
At the first autopsy?
at the first autopsy. And I looked at the lining of the mucosa and I found no pathology.
Right, if we get to paragraphs 14 and 15, I don't think there's anything particular to report there.
Yes,
In other words, a healthy heart and pericardium and healthy large blood vessels.
yes.
Okay. My lady, may I ask the court for a comfort indulgence? May I also ask the court, are we sitting till 2 o'clock today? Is that the plan?
Well, if it's now, I would want our session after this to be worth its while. So to at least run for about an hour to hour and 15 minutes. If we return at 1:15,
As the court
if we
pleases.
can then, we'll sit until 2:30.
As the court pleases. Thank you.